Remote collaboration and evidence-based care. Typically, the remote collaboration and evidence-based care video for Capella entails uncovering the evidence-based decisions and other proper activities. My name is Vanessa, and my project constitutes promoting better health results and quality care for patients regarding the Villa Health context. By offering a suggested evidence-based model care plan, I intend to influence patients' results positively. A reflection of the most relevant evidence of the suggested care plan is also one of my core objectives. I aim to explore the importance and plans of interdisciplinary collaboration among all the small groups. In providing an overview analysis concerning the Capella Villa Health context, the evidence-based care plan and remote collaboration are essential. Caitlin Bergen, a 2-year-old female, was brought to an emergency department after being discovered with specific breathing difficulties. Her temperature recorded 101 degrees and was associated with other symptoms such as shallow respirations of 32 per minute and thick secretions. In effect, the patient was discovered with pneumonia after thorough clinical investigation was done. Upon extensive assessment, the patient realized a loss of weight far below the expected percentile of a young child of similar age and level. As this case, Dr. Copeland holds a different opinion as he suspects cystic fibrosis. He recommends a sweat chloride examination which shows positive results, Villa Health. Dr. Copeland further recommends for nebulizer as well as the IV piperacillin interventions. An alternative recommendation constitutes a food diet rich in high-fat, soluble vitamins A, D, E, and K, calories and proteins with pancreas enzymes, Villa Health. Caitlin relied on chest physiotherapy to help in the breaking down of the thick secretions. Caitlin is also facing a devastating issue of achieving care coordination because her family resides long away from the healthcare institution they get quality care from. The town they reside in is located remotely and has insufficient resources for the specialized care needed by the Caitlin dynamic needs. On the other hand, Dr. Water Benjamin, a pediatrician, is insufficient to deal with patients suffering from cystic fibrosis and entirely relies on Dr. Copeland's expertise and care. The whole family also relies on telemedicine to address issues with Caitlin because of the remote location, Villa Health. Another essential point to note is that the family is experiencing a severe financial crisis in insurance issues and taking a long time to attain effective care. Her parents are divorced, which devastates an effective care process, Canada 2016. Moreover, Caitlin's mother is also stressed and devastated and lacks adequate support from the area's teams. RIHUB note that evidence-based practices regarding telehealth medicine are an essential process. As for the article, evidence-based practices improve patients' results and promote safety results. The majority of the people living in rural areas are associated with specific economic barriers that restrain accessibility to healthcare services. Hospital appointments are the reasons for medication errors, particularly in pediatric care for most families. The fields of telemedicine provides ideal mitigation to the existing healthcare gaps. It would be necessary for Caitlin to conform to the follow-up processes, which could be influenced by the family members, such as the mothers, to attain useful for Caitlin. With Caitlin's new diagnosis, routine education, as well as assurances are entirely required. More importantly, telemedicine provides an excellent chance to provide care for the family. Since there is suspicion that Caitlin could be suffering from cystic fibrosis, specific care should be considered to realize accurate health results. Her family is also obliged to conform to the strict prescriptions on a diet alongside the pancreatic enzymes to uphold unique weight maintenance. With reinforcement on Caitlin's age, it is difficult for her to experience huff coughs to crumble the developed secretions. Instead, she relies on chest physiotherapy to break down the secretions. It is essential to provide education on proper ways to adhere to the suggested medical intervention, critical in the Caitlin outcomes. Extra information is needed to implement an effective and robust care plan for Caitlin's family. Irrespective of the financial crisis that the family is facing, additional information is critical to realize effective dispensation, deployment resources, and proper medication and care for Caitlin. Besides, an aspect of Caitlin's father appeared missing in the case. Education was only conveyed to the mother. Therefore, it was imperative to enlighten both Caitlin's patients to participate in her process. Since it is vital to adhere to Caitlin's care, telemedicine should be potential evidence-based practice model. While Caitlin's family is remotely located with impractical resources to handle cystic fibrosis care, the family heavily relies on the nurse's productivity and competency from the healthcare facility. Aston and McCabe, 2012, outlined prudent insights concerning telemedicine's evidence-based practice, which is revealed. As mentioned above, the article confirms that telemedicine model increases patients' experience and satisfaction and collaboration among the numerous healthcare providers. In effect, telemedicine provides crucial outcomes for patients. It is essential to note telemedicine is imperative in the context of the interdisciplinary cooperation approach. As suggested by Grant Rockwood and Sten's 2014, team-based practice coordination and collaboration, collaborative decision-making processes, and partnership are core strategies to attain an integrated care approach. As stated above, the Caitlin specialized care is 1 hour away. Hence, it would be necessary for Dr. Benjamin, the pediatrician, to consider integrating a coordination care approach with key parties such as Dr. Copeland. More importantly, interdisciplinary cooperation provides a leveraged process to attain positive results for Caitlin. In conclusion, an imperative-based practice care strategy is needed to address the patients with an intricate condition known as cystic fibrosis. It is worth noting that care may be intricate in case the patient resides in rural areas. Issues related to hospital appointments impose a problem of traveling, primarily when situated in remote areas. Consequently, telemedicine is the appropriate evidence-based plan to provide solutions to the obstacles that restrain the provision of quality care to the patients. Irrespective of the financial crisis that the family is facing, additional information is critical to realize effective dispensation, deployment resources, and proper medication and care for the patients in the healthcare setting. Thank you.